this is Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about orthotics, specifically how to break in a new pair of orthotics, as well as how to care for your orthotics. In podiatry, we use orthotics to treat a number of different foot-related conditions. Now, orthotics are not a panacea for every single foot condition. However, a large amount or a large majority of foot conditions, especially chronic foot conditions, can be in some way related or tied into abnormal foot structure, typically either too high of an arch, too low of an arch most commonly, or other mild deformities that are a direct relationship to one's bone structure and the way that their foot is interacting with the ground. For that reason, orthotics are often used in conjunction with a treatment program for many different foot and ankle conditions. Orthotics are often not the only thing used for treatment, but are used for long-term management and control of one's foot structure in order to prevent these different conditions from returning again. Basically, an orthotic is an insert that is made of a mold of one foot. This is a standard example of a typical orthotic. A mold is taken of the foot where part of the foot is held into a neutral position, the joint that kind of controls the pitch and roll of the foot, called the subtalar joint. This is held into a typically a 0-degree position so that the foot is neither flattened nor in a position of having a high arch. And that's sort of considered the quote-unquote normal position anatomically for the foot to maintain itself in. And from there, the orthotic is made with certain modifications based on one's mechanical exam in order to allow that particular joint to stay in as close alignment to normal as possible. The orthotic can be simple like this, or it can have a top cover on it, which is essentially just padding that covers over the surface, sometimes only going 3/4 of the length, sometimes all the way to the end of the toe. And the padding itself doesn't do much except for improve comfort in some people that just simply have to have a little bit more coating to the top layer of the plastic. But the orthotic itself works very well, but sometimes has to be broken into in order for one to become accustomed to wearing it. Some people are just a little bit more sensitive on the bottom of their feet to something creating pressure within the shoe. Most people can tolerate orthotics without any issues, but a very small subset of people have difficulty either getting used to the orthotic or tolerating it outright. It is very rare in my practice for somebody not to be able to wear orthotics at all. There's a very small number of people out there that have that issue. But the majority of people tolerate orthotics well and actually do not even notice that they're inside the shoe. But some people do have to break these in. There are two different schools of thought on basically how to break in a pair of orthotics. The more conservative way of doing it is once someone receives their initial pair of orthotics, or even a new pair of orthotics, because if you are casted 5-10 years down the road for a new pair, you will have to possibly break in those new pair because they're going to be slightly different than the older pair, and your foot mechanics have changed over that period of time. The more conservative route is to simply start wearing the orthotic the first day for perhaps an hour or so, and then the orthotic is taken out of the shoe, and then the next day it's worn again inside the shoe for 2 hours, and so on. So the third day is 3 hours, 4 hours the fourth day, until about 2 weeks have passed, and then you should be able to wear the orthotic for a typical 14-hour day on the feet without having any substantial discomfort or any issues. The other way of looking at it, sort of the other school of thought, is something I actually do, is I basically tell my patients, just start wearing your orthotics. If they feel uncomfortable, go ahead and take them out and either leave them out for a few hours or for the rest of the day, and then either a couple hours later or the next day put them back in again. And continue this process until the orthotic feels comfortable and you don't even notice that you're in your shoe. And most people, this is an easy process to go through. They can break them in successfully without any issues. In fact, majority of patients that I see are actually able to wear their orthotics right from the start without even needing a break-in period. But some people do need to go through that break-in period. As far as care is concerned of the orthotic, most orthotics are made of some form of a thermoplastic, might be different colors and slightly different compositions, but in general orthotics you can clean them, but hand washing is the best if they become soiled. This white material sometimes can become soiled and it's easy to clean with a little soap and water. You don't want to put a orthotic in a dishwasher or washing machine because the heat from those devices will actually cause the thermoplastic to melt down and break down, and then you'll lose the correction that you gain with the actual orthotic itself. So hand washing is easiest to perform. Now, if there's a top cover on it, obviously you have to let that material dry in order for, before you can start wearing it again. Another point of care is that if you are a dog owner or go to a place that has a dog, especially with the bare plastic orthotics, the dogs will try to use these as a chew toy. I've seen it many times, and especially puppies will look at it almost like a rawhide pig's ear or something like that and start to nibble on the orthotic, which will create little divots and dents, and that can be uncomfortable to walk on, especially if there's a little bit of sharp piece of material that sticks out with that. So it's always a good idea to be careful with your orthotics around dogs. And I have seen dogs remove them from certain shoes, especially looser fitting shoes, and then chew on them. So if you go to a friend's house, just make sure that you keep your shoes, if you take them off, in a place that the dog can't get to them. Speaking of shoes, when you go to buy new shoes, you want to always make sure that the orthotics go with you to purchase the new shoes, and you should be wearing them anyways. But if you're not, then you could potentially buy a shoe that the orthotic might not fit into well, and then you've simply wasted your purchase on that shoe because you won't be able to fit the orthotic into it. So it's very important to try on new shoes and try them with the orthotics in order to make sure that they're comfortable and that you can wear the two of them together. Orthotics can be modified. There are ways of adding pieces and changing angles and things like that. So there is the ability to modify these even after they've been manufactured in order to either make them more comfortable or to serve another purpose in order to change certain angles and certain ways that the orthotic fit in case other conditions arise that maybe need slight modification of the orthotic itself. So the modification potential of orthotic is pretty good, and these should last a good long time. Most people can have their orthotics for many, many years. The actual material itself isn't going to crack, break, bend, or wear out. And so one should be able to wear their orthotics for at least 7, 8, 9, 10, sometimes 15 years. I've seen some people have their orthotics successfully for up to 20 years. However, the foot does gradually change positioning and structure over a long period of time. And so typically an orthotic will not necessarily last that many years. Not the material itself, but the fit and the way the orthotic functions within the foot. Your custom orthotic should last you many, many years and provide you with a significant amount of foot support. But you simply do have to take care of them and allow for some break-in period to become accustomed to wearing them. But otherwise, you should have good success with their use, and it really should help prevent many different conditions that can arise as a result of or indirectly due to abnormal foot structure. Well, I hope you enjoyed this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.